It's darkest before the dawn. Authorities in Europe cautious, very cautious, but the record breaking infection rate of the Omicron variant could soon be followed by a sharp decline in COVID cases. Last couple of days, the numbers down in Britain. But as they say here, a swallow doth not a spring make. That still leaves the most vulnerable at risk: the elderly, those with pre existing conditions, and the unvaccinated. The unvaccinated, which now have a new poster child. We'll be asking about the saga down under of world number one tennis player Novak Djokovic. It's about more than just one man, no matter how famous, rich, and powerful. As the planet enters the third year of an unprecedented pandemic, French school teachers say they're worn out by the uncertainty of constantly changing rules on testing and isolating. We'll ask about their big strike action this Thursday, as well as, well, vaccine passports, booster jabs, and the best way to make it through what now seems like the worst of the current spike here in Europe. Today in the France 24 debate, how to manage the wave. Joining us is Gabriel Latanzio, English teacher at the Paul Robert High School in Les Lilas, who joins us from that Paris suburb. Also with us from London, Oksana Pizic, lecturer in pharmacy and practice and public health at University College London. Welcome to the show. And from Denver, Colorado, Jennifer Reich, professor of sociology at the University of Colorado, author of Calling the Shots: Why Parents Reject Vaccines. Thanks for joining us. The France 24 debate, where you can join the conversation on Facebook and Twitter, hashtag F24debate. Yeah, let's talk tennis for a minute. The defending champion getting the top seed of the draw at the Australian Open. Novak Djokovic out of his detention at his COVID hotel and on the practice courts in Melbourne. But the government could still decide to send the Serbian home. The international press still scrutinizing his movements during the 2 weeks before he flew out to Australia. Here's a photo of Djokovic courtside at a EuroLeague basketball match 2 days before he tested positive, according to his visa form. He's also already admitted an error of judgment in a statement on Wednesday when he agreed to that December 16th photo shoot and interview for his Sportsman of the Year award for French sports newspaper L'Equipe. Now there's scrutiny over whether Djoko traveled to Spain when he should have stayed in place in Serbia. Vocal in Djokovic's defense, his family, which has skirted the issue of whether or why he's not vaccinated.
You know, the vaccination, it's not that I'm against vaccination. Of course, I'm not. But I think that also if you are vaccinated, it's not that you are protected from the coronavirus. Lots of people that they have 2 vaccines or 3 vaccines, they get ill. So I don't understand this law that only if you are vaccinated, you can play.
So first of all, what would you answer Oksana Pizic to the mother of Novak Djokovic when she says that there?
Well, certainly we know that vaccines make a huge difference when it comes to severity of symptoms. So if you have had 2 doses as well as a booster jab, then you're more likely to have no symptoms, an asymptomatic case, or very mild symptoms. And it helps reduce burden on healthcare systems. So that's why there has been such an international plea for everyone to get their booster jabs in the light of this super infectious variant, Omicron.
Super infectious variant, and we now have it really blowing up over Djokovic. This sword of Damocles over his head. He could still get expelled from the Australian Open. This story could run and run. Is that good news or bad news, Oksana?
Well, I think majority of Australians are, they endured some very difficult times. They made big sacrifices in the name of their community, loved ones, and country. And they did so willingly with the benefit of waiting for vaccines to arrive. So I think that there's just no public appetite now for double standards. We're seeing similar problems here in the UK where rules are broken taken, people are being held account to it. So I think that unfortunately, someone who is in such a high profile position with such a platform, it is negative role modeling, and it's really disappointing to see.
Yeah, get your jab, Novak. That's the advice on sporting grounds from tennis legend Boris Becker. He told the BBC this could all come back to haunt the Serbian.
The French Open will watch the Melbourne saga, as I want to call it. I'm sure Wimbledon will watch it, and I'm sure they're going to have strict rules who can play and who cannot play. So personally, I would advise him to get vaccinated eventually because life will be easier for him. But again, he's old enough. It's his choice, it's his body, it's his life, and we have to respect that.
So, Jennifer Reich, on your side of the Atlantic, there already was a sporting poster child for the unvaccinated, which was the basketball star Kyrie Irving, who's sitting out the NBA season because he won't get his jabs. What have been the reactions where you are to this whole affair, if you will?
I think the Djokovic question and all these elite athletes bring up one of the core problems we have in how we talk about vaccines. Individuals like to think of themselves as unique and able to make their own decisions. And that's a really important thing we hear throughout the NBA, throughout the National Hockey League here as well. And it's important that individuals have bodily autonomy in making their own decisions, but there are consequences to those choices. And we're hearing that, I think, on all sides of the Pacific and the Atlantic, that you can make choices not to participate in public health campaigns, but that may cost you some opportunities, and it may cost you the ability to continue as the lead in your sport. It may cost you your salary within professional leagues, and it may cost you a lot of opportunities, and that there are often consequences to those individual choices. No one should be compelled to be vaccinated, but it does not mean that you necessarily have a pass to everything you still want to do. And we're seeing that from everyone from elite athletes down to school children.
And you heard Oksana a moment ago allude to the fact that the British Prime Minister, Boris Johnson, could in fact be forced out of his job over lying when it comes to breaking the COVID rules at Downing Street. This idea of one set of rules for the elites, like tennis players and prime ministers, and another for ordinary citizens, is that a big talking point where you are?
I think throughout the world we're having this conversation. And I think one of the things we could boil down Djokovic's story to at its base level is he lied on his immigration forms. And he lied about leaving the country. He lied about his knowledge of his disease state and his testing status. And when we stop and pause and say, what other traveler would be granted an exemption under these conditions? I think most of us would agree that there are very few people who could lie on their immigration forms, be questioned about it, and then still be given elite opportunities within that host country. And that's a country where parts of the country have experienced as many as 250 days where their cities have been shut down. They have absolutely taken a hit for their community, and I can see their frustration in having sacrificed so much to limit infection spread and then to be facing this kind of elite treatment. And you're right, Australia is not the only place grappling with these choices.
Yeah, the vaccinal status of the world #1 tennis player forcing Serbia's president into a political tightrope exercise. Let's take a listen.
Well, that's just how it is, I think. I believe that vaccination is vital for people. I received 3 doses already. I will receive the 4th if that is what is needed. I believe that vaccines have saved thousands of lives in this country, and I think it is irresponsible not to get vaccinated. But I am not such a person to launch a witch hunt against those who are not vaccinated, not because I need their votes, because my position on vaccination is very clear. I think that it is partly our fault because we let social networks spread conspiracy theories, absurd issues, and false results. We didn't manage to fight this.
Jennifer Reich, blame it on social networks?
It's different kind of social networks. It turns out that all of us ask our friends and our neighbors what the choices they're making for themselves and how they are making decisions about vaccinating themselves, what they're eating, what they're buying, right? We all look to our social networks, and it doesn't necessarily have to be misinformation all the time that leads us to make decisions that aren't in the best interest of our communities. And so when we think about, who are we talking to, where are we getting information, who do we trust, whose values align with ours, what we know is that we are all drawing on a variety of sources, and how much we trust those sources, how much they seem to represent where we're coming from is really important in all of our health decisions. Absolutely.
You talked earlier about individual decisions, and that if your individual decision is not to get vaccinated, well, you have to be prepared for the consequences. Now, the Canadian province of Quebec says it's had its fill of the unvaccinated hogging hospital beds. The government there has a plan. It hopes it can make it through its provincial assembly. Make them pay. Nadika Bael has that story.
Adults in Canada's second most populous province, Quebec, will be enforcing a health tax on people who refuse to get the coronavirus vaccine, the provincial government announced Tuesday. The Premier said that the 10% of Quebec residents who've not received any doses must not harm the 90% who have.
The vaccine is the key to fight the virus. This is why we're looking for an health contribution for adults who refuse to be vaccinated for non-medical reasons. Those who refuse to receive their first dose in the coming weeks will have to pay a new health contribution.
He added that the measure is a consequence of unvaccinated people putting what he called a burden on the health service, with the 10% unvaccinated accounting for around 50% of people in intensive care units. The no-vax pay tax policy will not apply to people who cannot take the jab for medical reasons, and the provincial finance ministry said the amount would not be less than $100 Canadian. Unvaccinated people are already banned from non-essential stores in Quebec, including shops selling alcohol and cannabis. Quebec remains one of the worst-hit Canadian provinces for new coronavirus infections, as the country struggles to contain the Omicron variant. Prime Minister Justin Trudeau announced Monday that his government had enough doses for all eligible Canadians to receive a booster and a fourth dose. The country's death toll from COVID-19 surpassed 12,000 as of Tuesday.
A tax on the unvaccinated. Oksana Pizik, what say you?
Well, I think the hospitals and healthcare systems have been under tremendous strain over the past 2 years, and in many cases are worse off now than they were at the beginning of the pandemic, with less health workers due to burnout and many other factors. I do think that in this instance, where incentives are not winning out, we have to start looking at ways to ensure that there is a higher amount of protection across the population and build up immunity. So because it has been so costly to our health services, it makes sense that we look at a tax for that specific purpose.
Makes sense. You agree with that, Jennifer Reich?
I think it's really important to think about, people paying their share. And what we see in the U.S., where we have a privatized healthcare system, is that some companies are opting to charge more for health insurance for people who opt out of vaccines because they cost more in total. The challenge, of course, is to ask the question of whether something like the Quebec law will increase inequality. So are they most likely to penalize people who have the fewest resources, who have the least opportunity to access vaccines? And is that actually going to be an incentive to those who are wealthier but choose to opt out? Or is this something that's going to disproportionately punish those who are already the worst off in terms of the outcomes of the pandemic? And that's something that requires a great deal of attention and sensitivity.
Let's bring in Gabrielle Latanzo, who teaches English at Paul Robert High School in the Paris suburb of Les Lilas. Gabrielle, the Skype gods were not with us. You're with us by telephone, unfortunately, but we're glad to have you. You see that there is this sense that public opinion is, after more than 2 years, is really turning now against the unvaccinated, against Novak Djokovic, against those who hog up hospital beds and who make up the majority of them. We're seeing that in Italy now, you're going to have vaccine mandates for over 50s. In Germany, they're close to the Bundestag approving such a measure as well, a vaccine passport like the one that's going through the French Parliament right now. Your thoughts on this, the fact that public opinion really seems now to be turning against the unvaccinated? All right, we seem to have a problem with the line with Gabriel Latanzio. We'll try to reconnect. I'll put it to you, Oksana Pizik, until we can reconnect there with Gabriel. There is this sense now that public opinion is it the same where you are right now in the UK?
Well, I think there's so much polarization around vaccination, and it's been further politicized, which has been detrimental and towards getting overall immunity and ending the pandemic faster. If we can help individuals remove the barriers, and this is an important point, we shouldn't be looking at, financial taxes as the only thing that can help. Absolutely, we need to remove barriers that currently have been preventing people from getting vaccinated. In some countries, that might be that is there somewhere easy for them to get it, like mobile van units, getting time off and being paid to be vaccinated is also really important, and really engaging with these communities as well. So I think we need to have a multi-layered approach to help with both persuasive tactics, but as well as looking at what the needs of the healthcare system are. And as I said, we're places like the UK with the NHS, which has had decades of austerity, means that even before the pandemic, we have the lowest number of ICU beds out of all of Western Europe. And so right now, there's so much pressure in terms of A&E wait times, availability of ambulances, and all of these other factors. So I think that especially healthcare workers, they have done so much for us throughout this pandemic, and for people to then continuously show up in ICUs because they didn't get vaccinated, it becomes difficult. But we must remain empathetic towards people who are suspicious of the vaccine, precisely because there's so much convincing misinformation, and we haven't found an effective solution for that yet.
Yeah, you talk about the years of underfunding for the National Health Service in the UK. We've had, of course, similar discussions here in France during the first wave when we were clapping for carers. The number of cases today, more than 2 years on, off the charts. But so far, this is a graph showing the number of people in intensive care units. It remains, it's on the rise, as you can see. But in places like France, it remains manageable. But there is that sheer exhaustion of hospital workers and teachers. Here in France, they were out in the streets this Thursday. They're tired of rule changes, classes that open, classes that close, testing rules that evolve, and having to phone 30 sets of parents each time one of their pupils catches COVID alongside them. Parents angry over decades of gradual, and this goes back to Oksana's point, underfunding for public services, in this instance, education.
Ça fait 3 semaines cumulées depuis le début de la rentrée qu'elle n'a pas eu classe à cause de la maîtresse malade et absente et sans remplaçante. On a eu aussi plusieurs cas de Covid dans la classe. On se réveille le matin en fait et on ne sait pas s'il y a école, s'il n'y a pas école, si on doit faire un test, pas de test, si on va rester à la maison, si on va pouvoir aller au travail.
Là, le manque de profs, c'est pas parce que maintenant il y a le Covid, c'est depuis des années qu'il y a de moins en moins de profs. Et donc là, ce qui fait que là, à la rentrée en janvier, il y avait 70 classes sans profs juste sur une circonscription, juste sur une ville.
Gabriel Latanzio, are you with us?
Can you hear me?
Loud and clear. Your thoughts before we go back to the broader issue. Your thoughts on the big strike action that took place in France this Thursday. What's behind it, and what are your thoughts about it?
I'm very happy about how the day went, to be honest. Look, of course, the sanitary crisis did not start today. And of course, the place of schools in that crisis is not just a topic that deserves to be talked about just now. But here's what teachers did. They did not just talk about the COVID crisis. They talked about schools the entire issue of schools. A lot of commentators today are saying, look, it's about how the protocols we have are not practical enough. Most parents spend a lot of time at pharmacies hoping to get self-tests, etc., and so on. I respectfully disagree. I think what happened today is too profound for it to be just about the procedure. If we liked the education secretary, if we believed he was doing a good job of the past 5 years, what happened today would never have happened. I've never seen my colleagues being so clear on a matter such as this one.
Yeah, just to be clear for our viewers, there were protocols in place for classrooms, and particularly for for primary schools. And then on the Sunday, they changed the rules for Monday.
Right. And they did so without telling teachers. The way it was announced was that it went to the press first. But to be honest, it's been like that for 2 years. It's not the first protocol. I've seen, I think, about 20. And I can't remember one time when we got the news by our professional email. It was always
Can you fault the government, though, for changing the rules? Because we're getting new data. This is an unprecedented pandemic. Can you fault the government if, they adapt to the reality that's changing?
It sounds logical, doesn't it? Well, look, I think what they did actually is they were worried about the impression they would make to the public at large. The discussion we've been having is, do they change it too much, et cetera, and so on? Or is the protocol adapted? Look, I think the conversation is, are we doing anything at all? It really is more simple than this. I believe the many changes in protocol serve one purpose: political showing. That's it. Say, oh, we're doing something. But the truth is, ask any teacher, it was us versus the problem. And we had no concrete material help for a year and a half. If you look at what happened internationally, as France 24 like to do, you will see that many, many nations have decided to invest in their school systems. We have done the exact opposite. Over the past 3 years, hundreds of millions have been given back to the budget secretary from the education secretary. And that is a shame. Keep schools open. Look, as if it was just a matter of political will against people hostile to kids. And who would those people be? Teachers who have decided to dedicate 40 years of their life to teach kids. Do you really think we're there to make them fail? And if they fail, don't we fail through them? No, this is ridiculous. This was purely a matter of political balance. And the situation now is that people see it for what it is. It was not in the interest of the majority.
All right, let's talk about this more specifically, because we're really dealing with the fact that now the Omicron wave is running rampant. It's running rampant in workplaces. People are catching COVID for the second time, sometimes even the third time. A word on the new rules for schools. Pupils allowed to self-test if a classmate's infected. You're not closing down classrooms. And self-test means you don't have to go out and get a PCR test. Parents don't have to stop what they're doing in the middle of the day. For the government, it will make life simpler for parents and for teachers, though. And as Gabriel was saying, the aim is, says the government, is to try and keep the schools open. Let's listen to the government spokesperson.
This new strategy is easy to understand. It means less waiting time, more flexibility, all while putting health safety first. We choose to keep schools open. We make the difficult choice of continuing to work over the easy choice of closing.
So if I understand correctly, the accusation that's been leveled by many primary school teachers, Gabriel, is that basically they're leaving primary teachers exposed because they have a higher risk of catching COVID now in the classroom.
I think so. Look, it's. I believe it's math, right? Will our hospitals be able to weather the storm? Because it's not a wave. It's the worst storm you can imagine. Apparently, we can. Because of vaccination. I'm vaccinated. I hope as many people as possible are. But I believe they just decided, we can afford that. We don't have to do more. No, my whole point is, if you want to keep schools open, you need to do something. And you can't just say, here's the playbook. Here's what you should do in case of this happens or this happens. No, you also need to give, to recruit more people. You also need to make sure that the buildings we have are ventilated enough. All these issues that we haven't talked about in years. So No, I think something has happened today because teachers are really mad and they're united. And I'll bet you something. In the coming weeks, we will see a clear change in the way we discuss schools. And it will not be just about COVID. It will be about, okay, how important our schools are.
Oksana Pizik, at the outset of the pandemic in March of 2020, Boris Johnson was skewered for suggesting or even hinting at a strategy of trying to attain herd immunity. At the time, there was no vaccine. We didn't have masks, in fact, most of us. Now, listening to what's happening here in France, is that what's happening on the sly, that governments are going for herd immunity?
Well, I think they're looking at it in a different way than in March 2020, where there was virtually no protection, no vaccines. So herd immunity via natural infection is much more dangerous than getting antibodies and being exposed to the virus with some layers of protection. Now, of course, for those that are the most vulnerable and elderly, it doesn't mean that it's not, there is no risk. I mean, it'll still be dangerous to some people, but the being exposed is also why it isn't as dangerous as it was in March 2020. This is why in the UK, they've also shortened the isolation period. They're weighing up the risks, the fact that Omicron is so prevalent now. There are so many, even though cases are slowly coming down, they're still very high. And 1 in 10 health workers have been off sick. And this is affecting outside of the healthcare system too, in schools and supply chains. And in order for society really to carry on, they've had to weigh up the science and also look at what's practical with the fact that now we have high rates of vaccination, which means that there'll be less severe symptoms. So in some ways, I suppose you could say that is one of the strategies, particularly with this reduction in isolation period from originally it was 10 days, went down to 7, and now we're at 5, but with the condition that you have to take a COVID lateral flow test on day 4 and 5, which has to be negative in order to exit on day 6. But there is an example of weighing up the degree of risk that people pose, while we know that there's going to be a percentage of people that will continue to transmit Omicron. So by carrying on in this fashion, I think that it is sort of the new phase of achieving immunity via vaccination, and in some cases hybrid immunity, as people as there's breakthrough cases that occur as well.
Jennifer Reich, is that message that Oksana is putting out there getting across where you are, that herd immunity, sure, but only if you're vaccinated?
I think we've been thinking about infectious disease the way we've thought of it for 100 years, and it may not be applicable in this context. We have to remember vaccines are a lot of different things. They work in different ways. Some limit transmission. Hopefully they limit death and disease, but they're not all quite the same. And we don't have a lot of great long-term vaccines against respiratory illnesses in the way that we do against other viruses. So we have to think about our responses to SARS-CoV-2 differently. And when it gets to the question of natural, what gets called natural immunity, which is to say immunity derived through infection, we don't know that has any long-term benefits, and it appears to have less protection than does vaccines. And the cost of that may be high, and we don't know that yet either. So it's worth remembering that some viruses can cause long-term damage in the body that isn't understood for sometimes decades later. We can think of post-polio syndrome. We can think of the way measles erases your immune system. There's a lot of viruses that can cause damage outside of the immediate disease. And we don't yet know about this virus and what it's capable of. And so the idea that we should let a sizable number of the population become infected, and that's just the way it's going to be, is irresponsible when we have other options. But going back to this broader question about what are we going to do with our institutions, I want to make sure we make the point that it's a mistake, and we're doing the same thing in the US right now too, of pitting teachers against families against the government, that we're all somehow on different sides, and our two options are close schools, which we know is not good for kids, or leave them open, which may feel vulnerable to other people. And we do have other options about how to use what we've learned over the last 2 years. And I think that there's a lot to say about the data we have about what high quality masks do in classrooms to limit transmission, It matters that we have ventilation in schools, not just for COVID, but for a variety of infectious diseases, that it's an opportunity to really think about how do we make our communities healthier. And that should include preventing infection, but it should also include a range of other kinds of interventions.
Yeah, and we heard President Biden this Thursday talk about more testing being available. That, Jennifer, is one of the big demands of those teachers who are marching in Paris this Thursday, better access to tests.
I think at this juncture, we are really stuck between what would be the best solution based on our current knowledge and pragmatically what's possible. So, for example, the US also shortened its isolation and quarantine periods after exposure to COVID from 10 days to 5 days. But the CDC, our national advisory groups, are not recommending testing, in part because there are no tests to access right now. And while we have millions of tests on order, it's really challenging to get home tests. We know they're on average about 65% successful unless you are at the peak of viral shed and infectiousness, in which case they're more effective. PCR turnaround times on testing is very slow. And so the relevance of having a good PCR test, but the results are 4 days later, may really limit our abilities to have successful informed kinds of interventions. And so there really is this tension right now between what's pragmatically possible and what should be our goals. And I think sometimes we run the risk of losing the goal in the process of recognizing we can't achieve it right now. Even as Omicron rates are going to drop, we should be building that kind of best practices in place so that when the systems are less overwhelmed, we have a place to turn to when we know there will still be viral spread in the community.
Gabrielle Latanzio, based on your experience going into the classroom as a teacher, what's your reaction listening to Jennifer?
Oh, very much agree, as you can imagine. Look, when it comes to mitigating the effects of the crisis, we have three people who can do things, right? Some can give up comfort, right? Some can take risks, and some can lose money, right? I think it comes down to these three actions we can have: giving up comfort, taking risks, or losing money. Well, I believe many governments have decided to make it so that some people will not lose money, right? So what do we have? We have debt. So, well, the people who lose money are future generations. But we have people who give up comfort. We've done that. I don't think it's too big a deal. But what we have is thousands, tens of thousands of professionals who have been taking risks, and that's an issue. Now, as for the conversation as to what we do when it comes to our plan over the long term, yeah, look, I'll give you a statistic that I can't get over. It's just fascinating to me. The French school system has a particularity. It is that it is united. We are over 1 million professionals taking care of over 12 million kids, right? That's fantastic. I guess that means we can, make sure that it works well together. Do you know how many full-time doctors we have to take care of the 1 million professionals we have? We have less than 68 full-time professionals, less than 68 full-time doctors taking care of over 1 million people. They don't do it. I know my colleagues, we never meet a doctor. I think some of my colleagues have met them when they entered the job, 15, 20, 25 years ago, and they've never seen them again. There's no prevention. There's no discussion. And I do see, sometimes health professionals, for instance, psychologists, whenever it is we have a tragedy happening at a school, but they come here for like an afternoon and then they leave. So, no, we definitely need to think about how lucky we would be to have a strong health system and a strong education system working hand in hand.
We're running short on time, and we're having this discussion when it really feels like we're at the height of this Omicron wave here in Europe. Oksana Pizik, I want to call up again that graph we showed earlier about intensive care unit beds being occupied in certain European countries compared between Italy, France, the United States, the United Kingdom. So we have, in the US, it's higher because I guess there's fewer people that are vaccinated. In France, the number of people in ICUs is going up. In Italy as well, even though the vaccination rate there is even higher than here. And in Britain, it's flatlined. Why is that?
Again, I mean, I think there's a variety of factors at play. The UK also has had a very successful early booster program, so there has been a good uptake of this as well. However, we will see what the trends might be in coming months as well. So, or at least in the coming weeks. While there are, some predictions that we are on the downward slope now. I would say that we couldn't be for certain that the peak is done, and that we could be seeing prolonged pressures for a little while longer. So I would say that everyone is hoping that the fact that Omicron is less severe than Delta is perhaps the reason behind the hospitalizations. But even if we do see that there are fewer people in ICU, that doesn't also just completely nullify Omicron. Mild is sort of a term that makes us think of it as just as a cold, and it's certainly not the case yet. So hopefully this is a reflection of the fact that boosters
for
work.
instance,
There's less
because
hospitalizations
Oksana, we
than
look at the
Delta.
numbers every day, and we see, for instance, in Britain, the number of cases, the daily number of new infections, it went from 129 to 109,000. Here in France, we were at 370 yesterday. We're at 305 today. Are you suggesting those numbers don't mean a whole lot?
Well, with testing as well, there have been significant pressures on accessing tests as well, so that may be skewing it a bit. But it is likely that we're seeing, that's going to be a ballpark figure. So that doesn't mean that we can't have a rebound in rates as well. We have seen before as well in previous waves, particularly with Delta. It looks like it's on its way down, and then it starts to creep up again. So we're all hoping that it's a hairpin curve, meaning that the decline is just as steep and just as fast as its steep incline. But really, it's probably, we need a little bit of time to say.
Yeah, we had the health minister on Wednesday reacting to that number of 370,000 new cases within 24 hours, saying it probably means about 1 million people in real terms. Not everyone gets a test. But he said, Olivier Véran, that there's light at the end of the tunnel.
If we follow the data from countries which were hit before us by the Omicron variant, we can expect to reach the peak soon. But will it be a peak again, or will it be a plateau? I can't tell you that today.
By the way, he's tested positive. He's self-isolating. Oksana Pizik, is that the right message to be putting out for a public official at this time?
Well, I mean, from what I took from that is that he's saying, it's not a guaranteed that it's, not necessarily over yet. I think there has been a narrative in which, again, Omicron is passing quickly, the peak is shorter based on South African data. But in Europe, we haven't had the same level of exposure to other variants in the same way that region had, and they had a much younger population. So just because the peak passed quickly in that region doesn't mean that here in Europe we're going to see the exact same pattern. It could be that we're going down, and then we reach a plateau for a bit, and then we see cases spike again. It's difficult to say exactly how this is going to move through different age groups as well. Certainly, it's interesting to see that it's affected more and more children are appearing in hospitals as well.
Jennifer Reich, when you, the world over, when you're talking with colleagues at the water cooler, when you're on your Zoom calls with your family, when you're online at the supermarket, the conversation is, when's it going to end? When is this new normal going to be over? How do you manage expectations in light of what you just heard from Oksana?
I think all of us are exhausted, and we each hit our low point on different days at different times, but that we are tired. And one of the challenges is there's an impulse to say, let's just stop trying to limit infection and spread because it can't be controlled anyway. And we're starting to message, I think, really destructively that eventually everyone's going to get it anyway, and so why try? And the problem with that is, of course, that even if people who are fully vaccinated and have a third dose booster are not going to suffer the worst of infection, we don't know who they'll encounter. We don't know who's immune compromised in our communities. We don't know who's vulnerable. We know that children under 5 aren't even eligible for vaccination yet. And in the US and other places, school-age children have very low rates of usage of the vaccines right now. And so, again, infectious disease is never just about the individual. It always ties us together in ways that we can't fully manage by ourselves. and we are all exhausted, which makes it really hard to continue to try to work hard, to still wear masks, to still limit our places where we can go in person. And, I'll say coming out of the holidays, the number of visits and plans I canceled with my family to make sure we could make sure not just our family was safe, but that the people we encounter would not be in any way placed at higher risk was really hard emotionally. And also we thought it was the right thing to do. And so I think all of us have to continue to talk about why we're exhausted and then what we can continue to do anyway, because the virus isn't done with us. And I think that there's a lot of ways that we can continue to take what we've learned over the last 2 years and put it to work to protect those who most need it.
Yeah, it's about solidarity, protecting the ones we love and the ones we don't know even. I want to thank you so much, Jennifer Reich, for being with us from Denver. I want to thank Oksana Pizik in London, Gabriel Latanzio in the Paris suburb of Les Lilas. Thank you for being with us here in the France 24 debate.